Now,
Hey, my name's Dr. Isaac Jones, and I'm really excited to get this information that is literally life-saving information and transformational information to as many people as I possibly can, especially in the Middle East. Over in America, I worked in the largest health centers in the entire world, and I went from health center to health center and really gathered a lot of priceless information. And after I got my doctorate and went to all these different programs, I made connections with some of the top health and wellness experts in America, in North America, and Canada. And what was amazing is that these programs have enabled us to really help people overcome the diseases of the 21st century, or the diseases of the new millennium. And so there are so many people out there, there's so many countries that are developing these degenerative diseases and disorders that at epidemic proportions, at higher and higher levels than we've ever seen in the history of mankind. And you know, it's something that is very concerning. There's a lot of countries out there that are trying to implement various programs and various protocols and systems in order to prevent the disease from taking place in the first place, because economically it is a absolute a detriment to the actual economy of a country. Warren Buffett in America says that the healthcare system in America are like tapeworms eating at the bottom of our economic bucket. And so in America, we spend $2.5 trillion, actually last year's $2.7 trillion of our $12 trillion GDP, gross domestic product, on disease care. And this is they focus is on creating drugs for the covering up of symptoms and relief of various conditions. It's not on behavioral change. And that is what the future of healthcare needs to be focused on. It can't be focused over here on symptoms and on the effect, right? It can't be focused over here on disease and helping people overcome the pain and the suffering with the disease. It needs to be focused over here in the new health model on disease prevention, on health creation. This is the future of healthcare. It's in lifestyle change. It's in behavioral change. And so what we're talking about now is something that literally will transform the healthcare of entire nations. The research, the PhDs at all the top universities are saying that in order for people to overcome these diseases, we need, like Dr. Abbas is creating, like I've created over in America, these lifestyle design programs so that people can plug into them so that they can prevent disease in the first place. The economic impact of this in your country is absolutely huge. Think, we're going to have people function at higher levels. We're going to have businesses functioning at higher levels, increased income, happier and healthier people, because when you transform the physiology of somebody's body, you're also going to transform their psychology and the way that they think. According to Dorland's Medical Dictionary, the definition of health is the optimal mental, physical, and spiritual well-being, and not merely the absences of diseases and infirmities. The optimal physical, mental, and spiritual well-being. It's integrated. It's what they call holistic health care. And that is the future of what we're bringing. And these programs that I've created and that other people have created with me are literally going to transform people that are suffering from obesity and are really wanting to implement a lot of these strategies so that they can stop the disease formation from taking place in their body and remove the cause, again, of what's developing disease in their body. Not focused on effect and symptoms, but focused on cause. So I've created a program in America that has been an absolute success, where we have educated doctors across the country on these advanced strategies to enable them to implement them into their practices and into their office so that their patients can get the best results possible and overcome a lot of the diseases and disorders that they're struggling with. Again, it's through lifestyle design, behavioral change, creating a healthy lifestyle, mentally, physically, and spiritually, psychologically, as Dr. Abbas says. And it's really exciting to know that these programs really transform their offices. This program will be called the New Health Model for Physicians and Practitioners. An alteration of that will be developed for professionals such as personal trainers and also PTs, physical therapists. These physical therapists and PTs will enable, will also get a lot of this information, but just delivered to them in a different format so that they can go back to the gyms and their offices and their PT clinics and be able to give this information, this life-transforming information, to their patients and their clients as well. There's also advanced strategies to help people overcome the obesity epidemic. A lot of people that have obesity are developing what they call weight loss resistance. There's reasons why they're developing weight loss resistance. Obesity is reaching epidemic proportions, not just in America, but also in China, in India, and in Saudi Arabia, the Middle East, as well as in London, England, and all these other industrialized nations. It's absolutely astronomical what kind of an impact it has on the economy as well. And these obesity programs will enable people to finally figure out what the root cause of their weight loss resistance is, how to remove that cause, and so that they can overcome the obesity and the weight loss struggles that they've had throughout their lifetime. But at the same time, we have to engage their psychology. We have to create systems so that they can overcome the obstacles that they have mentally. That's another program that we'll have in the obesity and NLP, neurolinguistic programming course that we'll create. Other courses that we'll create is the psychoneuroendocrine courses. This is a new science. It's branched off of the Human Genome Project and epigenetics. And basically what this says is that your thoughts have a physical manifestation as far as how they impact the health of your body. So literally, your thoughts can impact how healthy you are. So we'll go into the science through this course of exactly how this happens and really how to enable people to optimize the level of psychology and of mental status so that they can truly be as healthy as they possibly can. And I know practitioners, doctors, and then also physical therapists and personal trainers will love this information because it's going to not only transform their lives, but their patients' lives as well and their clients' lives. Other programs that we could develop in the future are heart disease programs where we'll educate people on what the root cause of heart disease is. Why is it that people have high cholesterol? Why is it they have high blood pressure? There's simple answers and there's simple solutions to help people overcome this problem that's an absolute epidemic again. We're talking heart disease, diabetes, autism's on the rise. All of these learning disabilities, again, are on the rise. And there's an absolute massive market and crazy amounts of information that can be implemented into programs like a diabetes program, a cancer program, and seminar for people to learn what causes it and then how they can potentially remove it permanently. And it's not going to just affect, again, the practitioner's life, it's going to affect their client's life, and it's going to leave a lasting impact on the actual economic sustainability of a country so that we can truly enable your country and your different corporations to function at their highest level. What they found, that the National Institute of Health found in America, is that every $1 spent on healthcare, true healthcare, not symptom care, but on behavioral change and lifestyle development and design, you save $6. For every $1 you spend, you save $6 in medical expenses, in disease formation in these patients and these people that are working in these companies. And so, you know, the benefits are vast, and truly it's exciting to be able to work with you guys, and I'm really excited to develop a lot of these programs and get it to you so that whoa, there's a bird behind me. So that you guys can also get the same benefit that a lot of the health participants are getting as well. Have a great day. Dr. Jones here. Until next time, I look forward to meeting you guys, and I'll talk to you soon.